Hello, everyone. My name is Timothy Stinson, and today I'll be presenting on Lyme disease. This presentation focuses on Lyme disease from a public health perspective, exploring its causes, symptoms, patterns of infection, and what interventions can reduce its impact on our communities. Lyme disease is a tick-borne infectious disease caused by the bacterium Borrelia burgdorferi. It's transmitted to humans through the bite of an infected black-legged ticks, also called deer ticks. Once inside the body, the bacterium can spread through the bloodstream and affect multiple systems, including the skin, joints, heart, and nervous system. If left untreated, it can lead to serious long-term complications like arthritis or nerve inflammation. From a public health standpoint, Lyme disease is important because it's the most common vector borne illness in the United States, meaning it spreads through the insects and animals that carry pathogens to humans. Symptoms usually appear 3 to 30 days after a tick bite. The most recognized early sign is a erythema migraine rash, which looks like a red bullseye on the skin. Other early symptoms include fever, chills, fatigue, headache, muscle and joint aches, and swollen lymph nodes. If not treated, the infection can progress to cause severe headaches, facial palsy, joint swelling, irregular heartbeat, and even memory or concentration problems. Recognizing symptoms early and seeking treatment quickly are essential to prevent long term illnesses. Lyme disease spreads through a cycle between ticks and animals. Here's how it really works. One, small mammals, especially white footed mice, carry this bacteria. Two, young ticks feed on these infected animals and become infected themselves. And then three, when the infected tick later bites a human, it transmits this bacteria through its saliva. Ticks must usually be attached to the skin for at least 36 to 48 hours before the bacteria can spread, which is why early tick removal, especially after being outside, is one of the best preventative measures. This cycle is heavily influenced by environmental and ecological conditions, which makes Lyme disease a key issue for environmental health planning. Now, the current numbers, according to the Center of Disease Control and Prevention, the CDC, over 89,000 cases of Lyme disease were reported in 2023, marking a major increase compared to the earlier years. However, because not all cases are diagnosed or reported, the CDC estimates that around 476,000 people are diagnosed and treated for Lyme disease each year in the United States. That means the true burden is far higher than what we see in national reports. In many cases, go uncounted, especially in rural or under resourced areas. We primarily see the spread over the past 2 decades of Lyme disease, exploring far beyond its original range. It first appeared in northeastern US, but now it affects the mid Atlantic and even upper Midwest as well. States like Pennsylvania, Wisconsin, New York, Maine, and Vermont report the highest incident rates. Emerging hotspots now include even Virginia and Michigan, where tick populations are growing due to climate and habitat changes. This geographic spread highlights a connection between environment, climate change, and infectious disease patterns, which is critical in public health monitoring. We see this rise from 2022 to 2023 being increasingly more than what it's been in the past. This is primarily based on people not practicing safe methods when outside or not properly being educated about their environment. People primarily affected by Lyme disease is children aged 5 to 9 and adults aged 50 to 79. Men are slightly more likely to be infected than women, likely due to outdoor occupational exposure. These demographic trends suggest that prevention efforts should focus on school age children and outdoor workers, people that are primarily outside most of the time. From a public health perspective, this means targeted education programs can be more effective than one size fits all messaging that we see in our everyday society, similar to like a Bass Pro Shop or just the park news information. Risk factors include both behavioral and environmental elements. Behavioral people who spend time outdoors in wooden or grassy areas are at a higher risk. Not using insect repellent, not wearing long sleeves or pants, or failing to check for ticks after outdoor activity. Environmental areas with dense vegetation, high deer populations, and humid climates provide ideal conditions for these ticks to survive. Climate change, by creating warmer winters and longer tick seasons, also increases this transmission opportunities. Lyme disease doesn't just cause illness, it has a major economic impact. The average direct medical cost per case is estimated at about $1,178, and the total economic burden reaches hundreds of millions of dollars each year across high incidence states. Beyond the numbers, patients often deal with loss of income, chronic fatigue, or ongoing medical care, issues that can strain both families and healthcare systems. This makes Lyme disease a public health and economic challenge, not just a clinical one. This is exemplified when someone is diagnosed with Lyme disease, causing them to avoid going to work, avoid going to school, just worsening the burden on themselves and the economy. The goal of my intervention plan is to reduce incidence of Lyme disease through education and prevention in high risk communities. My primary target audience are children, outdoor workers like hikers, and groups that are frequently exposed to tick habitats. The approach focuses on awareness and early prevention rather than treatment after infection, which aligns with public health's goal of preventing disease before it even occurs. This education campaign would be integrated into schools, parks, and community centers. Students could learn tick safety through brief classroom lessons before being released from school, before summer break. Even outdoor workers could receive proper protective uniforms and tick removal kits. At hiking trails and parks, signs could display seasonal tick warnings with a QR code that links to preventive resources. This plan combines environmental awareness with behavioral change, helping people understand both where ticks live and how to protect themselves. To implement this program, partnerships would be needed between me and local health departments, the school districts, and certain park agencies. This campaign could be funded through small community health grants or corporate sponsorships from outdoor brands. Some expected obstacles might include limited funding, low public awareness, and community skepticism based off the idea that it won't be them who gets bit by a Lyme disease infected tick. To overcome these, we'd use sure, visually engaging messages and focus on the local impact, how prevention keeps families healthy and saves them money. This is based off of intervening with the children, letting them know that they need to look out for these certain ticks while they're outside, promoting parents to check their kids when they even come back inside so that we don't have ticks on children infecting them for longer than a 48-hour period. I would measure my own success based on the CDC's tick bite data tracker by noticing a 25% reduction in emergency department visits for things such as tick bites. A measurable increase in awareness and protective behaviors through community surveys before and after the program. This way, we can evaluate the effectiveness of prevention strategies using real public health data, as well as reaching out to the kids, seeing if they've learned anything beneficial and if they've implemented these practices into their everyday life when they're outside. In conclusion, Lyme disease is more than a seasonal problem. It's a growing public health concern tied to our environmental and daily habits. Through targeted education, community partnerships, and awareness of preventative behaviors, we can reduce infection rates and improve health outcomes. Thank you for listening, and remember, prevention starts with the awareness, the education, and the knowledge. Always check for ticks, use repellent, and educate the people around you so that when they're outside, they're paying attention to what's on their body, helping them from being infected with diseases such as Lyme disease. Thank you.